Welcome to this OncLive News Network presentation, Targeted Therapy in Blastic Plasmacytoid Dendritic Cell Neoplasm. We're going to spend the next 20 minutes focused on advances in the treatment of BPDCN. I'm Gary Schiller. I'm the director of the Heme Malignancy Stem Cell Transplant Program at the David Geffen School of Medicine at UCLA. And today I am joined by my colleague, Dr. Fazal from West Penn Hospital in Pittsburgh. Dr. Fazal.
Thanks, Dr. Schiller, for the kind introduction. My name is Salman Fazal, and I'm the Director of Transplant at the Allegheny Health Network in Pittsburgh, Pennsylvania, and specialize in myeloid malignancies.
We're going to talk a little bit about blastic plasmacytoid dendritic cell neoplasm. This is a myeloid malignancy. It is not common. It's been considered quite rare, but I can't really tell you an incidence because it was underdiagnosed in the past. And I think it'll take a little bit more data, a few more years of patient presentation to get an accurate assessment as to how common this myeloid neoplasm is. The typical patient profile is, I think, the reason that the disease is underdiagnosed. Often the patients are older, although there is no specific age distribution, but often they are older and they present to a dermatologist with skin lesions. It is very common that patients will present with a variety of skin lesions, typically papular, ecchymotic skin lesions on the trunk, but also on the extremities, often palpable, can sometimes be in the face, can sometimes be macular, and given time, they will go on to develop pancytopenia as this neoplasm will invade the marrow and produce hypoproliferation of normal marrow elements. So the typical workup really depends on where the patient presents. If the patient presents in a dermatologist's office, a skin biopsy may lead to a diagnosis. If the patient's pancytopenia is associated with complications such as neutropenic fever or thrombocytopenia, that patient might present in an emergency department, in an internal medicine ward, or hopefully on a hematology service, and a bone marrow might be the way that the diagnosis is made. The most important thing in making a diagnosis is histopathologic confirmation and working with a hematopathologist, because again, it's a tricky diagnosis, it's not easy, and a hematopathologist really needs to be involved from the moment of the skin biopsy all the way through the bone marrow biopsy. Otherwise, it will be underdiagnosed or misdiagnosed as some other primary dermatologic neoplasm.